Good morning and welcome to my channel. It is currently 5:50 in the morning. I am already ready to head to the hospital. Every morning before I leave, I go ahead and review in this little book that I use my notes from the day before about any questions that I had or any cases that came up that were interesting. So I go ahead and review those and know all of my notes. So going in today, you know, if I talk to a nurse or a preceptor or an attending or a resident, I can go ahead and, you know, discuss the case that I had with them or discuss any questions that I may have had. So it's early, it's 5:50, we're about to head to the hospital. Gonna be a good day. We have morning rounds and then we have a long day of inpatient service. Alright, made it to the hospital. It is a little bit before 6:30. We have a morning report first, and then we have to round on our patients, and then we will meet with the attending, talk to them about the plan for the day, and then round with the attending. Morning report is fun because somebody in the group goes over a whole case that they've had this week, and then we also kind of discuss some EKGs and maybe some fun tips. So typically it lasts about a half an hour to an hour, sometimes all the way the full hour, but it's always good. So let's see what today is. Great day so far. We're having a lot of fun. A lot of sick patients I'll tell you about later. So finished the day. It is 4 p.m. on Friday. Not too long of a day. Started at 6:30 in the morning and had morning report, and then saw all of our patients, and then took on about 8 additional patients. Right now we have a total of 8 in the ICU, and then we have a number on the floor, both on med-surg and telemetry. And I may explain a little bit about those later on, but we really got some fun cases today. And then also got some really sick patients, and you always just feel for not only them, but their family. So one of the things that I personally always struggle with is trying to balance, you know, excitement for fun cases and really interesting disease processes versus also really empathy and compassion for knowing that what they're going through is very difficult. And I don't think a lot of physicians really stop to think what it's like from every single patient's and their family's perspective. I think we try to at least get in the patient's shoes, and I think most physicians do a pretty good job about that. But understanding what it's like to be in the hospital as a family member, or as someone who's visiting, you know, a family member or a friend constantly, I think that that's very difficult and something that we don't actively think about enough. I've been unfortunate to have some of my family members in the hospital to where I've started to understand what it's like from a family's perspective, and that part I think is one about the hardest part. So I will discuss some of the cases later tonight, you know, at the end of the video, but it's only 4 p.m. on a Friday, and I still have a lot of things that I want to do. We had some interesting cases, and I always make it a point to go back and look up all of the disease processes that I saw today. And I think it's interesting to understand what are the clinical implications, what are the contraindications for different medications, what's the typical route in the hospital for those patients, what are typically things that you would order, both on labs and imaging, and what other specialists you consult. And I think that that's important to look that stuff up and really know everything that you can about a specific disease process. So because of that, it's Friday, we got done a little early, so I am actually about to head to the library and I'm gonna read up on some of the cases for a couple hours before the end of the night, just because we got done a little early. So one thing that I did get to see today, which was pretty cool, I got to see an endoscopy. That's where a gastroenterologist goes down through the mouth, through the stomach, and did some biopsies of different gastrointestinal ulcers, which was pretty cool just to check for H. pylori, but also because of some upper GI bleeding. That was cool because I got to see it done straight in the ICU. So the gastroenterologist, the whole team, the anesthesiologist, they came directly down to the ICU and did it right there as opposed to taking the patient to the endoscopy suite. So that was something you don't see every day. Some hospitals do that, some hospitals don't at all. So I thought I was fortunate enough to be there and was able to help out and kind of observe, but that was pretty cool. So now comes the fun part. Now to the library to study and see what we can accomplish. Alright, got in about 2.5 hours of studying done and read a few chapters of Harrison's Principles of Internal Medicine, which was actually one of my favorite books. I know that that sounds weird, but sometimes you find a textbook that has all of the things that you really need to know, especially for internal medicine, and Harrison's really is one of my favorite ones. Read a few chapters, and then also did some research on some of the disease processes we saw today. So Sjogren's syndrome, lupus, what else did we see? Guillain-Barré syndrome. So if you don't know what those are, you should look them up. They're pretty good, interesting disease processes and something that you don't necessarily see every day. So it was good to be able to review those, figure out which medications you would expect those patients to be on, and then also some of the physical findings that you would expect on a physical exam, and then kind of what the prognosis is for some of those. So finally made it home. That concludes the majority of my day, but it is 7:45 in the evening, and I still have one more thing to do. If you're wondering what it is, last thing to do, gotta get in my miles. Gonna go for a run now, and then we'll talk about my day and see if we got any interesting cases. Let's go. Run. I went and ate some dinner. All I had was some corn and some green peas. I typically do a pretty light dinner. It's a lot of calories, but it's just vegetables. And that's it. That was my day. That was a day in the life of a medical student who is in his third year doing internal medicine rotation, but also as a PhD who spends a lot of time on research and diving into some of the literature. So it's currently 9:30 p.m. at night. I typically go to bed at about 10:30 or 11 before I wake up. So I have about another 45 minutes to an hour, and what I'm gonna do is I'm gonna sit and look up some stuff that we saw today that I didn't get to look at in the library. And then I'm also gonna work on another YouTube video and another nutritional post for my Instagram. So I did mention that during my day, I didn't really talk about what happens in the hospital. So let me go through kind of the schedule of what we did, and then, I thought about it while I was running. I don't want to specifically talk about any patients that we saw because I think that there's some HIPAA violations and I just want to make sure that we're clear. But I'll talk about some cases that I've seen over the past few weeks and just kind of give some generics so you can kind of understand what it's like to be rotating in internal medicine and what it's like to be between the med-surg floor, telemetry, and the ICU and kind of get to do a number of different things. So during the hospital, when we get there at 6:30, we have morning report. Morning report, we go through kind of a case file that someone presents about someone that they've recently seen. We go through a few EKGs. We discuss one of the similar topics that we've been covering a lot or that we've seen recently in the hospital. And that's really a good refresher, but we get to hear from seasoned physicians about how times have changed and how they approach specific disease processes. And it's really great to hear their opinion, and then also things that maybe we forgot, or maybe things that we didn't learn because they're no longer teaching it in medical school, but back then they used to teach it. Nowadays, if something comes in, if it looks acute, we send them to get a study, whether it's a CT scan or an x-ray, whereas, a long time ago, that wasn't as prevalent, the use of CT scans and MRIs. So understanding the clinical limitations and also understanding the clinical awareness of what may be happening in a patient's body was crucial for them to understand what's a diagnosis and what potential differential diagnoses could be. And then after morning report, we go around on our patients. Typically we round ourselves or with the residents, and we kind of decide what's gonna happen for the day. And then we meet with the attending and we round on all the patients that are with the residents for that day. So that may take all the way up until 2 p.m. Sometimes we could be done at noon, sometimes 11. It just depends how many patients and how complex there are, or how many times we have to go back to an individual patient, depending on what they're having done. We have a lot in the ICU, so sometimes that may take a little bit more time. And especially if you get a lot the night before, overnight, then you really have to kind of spend the first day with those patients because they're new to the hospital system, and make sure you have everything ordered, you have the plan situated, you have the nurses that are on board, the respiratory therapists, the phlebotomist, physical therapy, speech therapy, make sure that they're all acquainted with the new patient. And it's really instrumental. I know a lot of physicians don't do that, but I'm learning from physicians that really find that it's their role to manage and coordinate the team effort in the hospital, which I think is really crucial. And then, after that, we maybe go around on our, then we make sure we get all of our notes and all the labs that we want ordered for that day, and also the next morning. That way the next morning we come in and all the labs are already ready to go. And then maybe we go touch back with some of the patients or some of the family members or touch some of the nurses before we're done for the day. So that's typically a day in the life. And then as you saw today, I went to the library. Some of the cool cases that we had today or not today, but just kind of over the past bit that I've been in the hospital that I think have been really fun, is we've had a lot of GI bleeds, surprisingly. I've mentioned, not necessarily on my YouTube channel, but I've mentioned on Instagram that I'm very interested in going into gastroenterology because of my research for my PhD. And I got to see endoscopies done in the ICU, which was really fun because most endoscopies, they go to a suite, and I just got to see it live. I'm not a gastroenterologist, so I'll save those lectures for hopefully one day, or for Dr. Austin Chang, who shout out to his channel, his links below, but he has, he's a gastroenterologist who's practicing endoscopist, so he has some pretty good videos on, different things that a gastroenterologist does. Other things that we've really seen have been, interesting cases of septic shock with patients that maybe have come in with lupus and severe diabetic foot ulcers that have then turned them into septic shock. Also had alcohol withdrawals from someone who's a chronic alcoholic, over years of drinking, over about a pint of Jack Daniels a year, or a day, drinking that much. So they obviously had a number of comorbidities and also alcohol withdrawals, and trying to stabilize them on their blood sugar and just deal with the liver failure that may be undergoing. So that's kind of a day in the life. I hope you guys enjoy this. I kind of rambled at the end, but You know, it's been a long day. It's been a fun day so far. Hopefully you guys got something out of this. If you have any questions, if you have comments, if you want to see me do it again when I'm on a different service, not on internal medicine, I'll be happy to do that. I'd love to entertain questions that you guys may have. I'm finding that YouTube is a great medium to kind of share some of my insights, whereas on Instagram I just kind of share some of like the bullet points, whereas, you know, on video I can really articulate some of the theories and the interesting concepts that we learn not only in medical school but things that I learned during my PhD. And don't get me started, because I haven't even started about talking about the gut microbiome and some things that I'm interested in. So with that, I hope you guys have a great rest of your day, whether you're watching this in the morning, the evening, or the nighttime. I hope you guys enjoyed this. Let me know in the comments. Go ahead and like this if you did like it. If not, give a thumbs down. I don't care whether you liked it or not, but I want it to be useful to you. And so if you did like it, let me know. Make a comment. And if you're not subscribed already, make sure you do, or share it with a friend that may be interested. With that, thanks guys, and I hope you have a great rest of your day.